It's super important to just keep an eye out for your kiddos during this time, especially babies. They're just not as adaptable as adults are to the heat change. So oftentimes they have a bigger body surface area than they do a body mass, indicating they just get hot more quickly than we do. So if it's hot outside and you're starting to overheat, it's possible that your baby has been overheating before you even. Babies also don't sweat as much as adults do. So sweating just helps your body stay cool, right? But baby sweat glands just aren't fully mature yet. So oftentimes they can't sweat like we can. So what can we do to help? Just pay attention to your heat advisories here in this area. Make sure that you dress your baby for the weather. So anything above 75 degrees or so, it should be okay for your baby to wear a onesie or a lightweight outfit. You can always bring, a sweater or a light jacket just if you need to. Babies above 6 months can wear sunscreen, which we do recommend. Make sure that you never leave your baby in a car unattended. Like say you run into the grocery store for a couple things and you leave the windows down. We never recommend that you do that just because it can get so hot so quickly. And then just make sure that you push fluids, right? So babies that are above 6 months that are eating solids or purees already, you can give an increased amount of water to those kids, or babies that are less than that age that are, still breastfeeding or formula feeding, you can just increase the amount or the frequency that you're feeding, just to make sure that you're dealing with their increased fluid needs. And then kids and adolescents, boy, we're outside all summer long, right? Between summer break from school and outdoor activities and sports, it's super important that we know the signs of heat exhaustion so that hopefully we can prevent heat stroke. Heat exhaustion kiddos are typically kiddos that have been outside for a while. Usually they're pretty sweaty, even clammy. They feel kind of tired and are even nauseous. It's important to get these kiddos inside or just even in like a cool shaded area. Make sure that you give them cool sips of water and just put like a cool compress on the back of their neck or on their forehead. Kids that are showing signs of heat stroke would be fever above 104. Kids that are super tired and out of it, almost disoriented or confused. A lot of times these kids will have a headache and they'll be dizzy or even like vomiting. These kids, we really want you to call 911 or take them to, a hospital immediately so that somebody can take a look at them and just make sure that they're okay. Another thing to consider in the heat is sun poisoning and sunburn. So I'm sure we've all had a sunburn at some point, right? It's just when we're in the sun for too long and our skin gets a little red and tender. Typically it lasts about 1 to 3 days and will get better with time. Sun poisoning is almost like an extreme sunburn. So these kiddos typically have red skin that's irritated and inflamed. A lot of times the skin will have blisters on it. And these kids can even feel sick, right? So they feel nauseous or dizzy. They just feel tired. So to find relief from sunburn and sun poisoning, make sure that you get out of the sun. Don't pick at your skin a lot. You can do Tylenol or ibuprofen just as you need to. And then we recommend cool compresses and over-the-counter creams like aloe just to help with the pain. To prevent these things in general, don't stay outside too long. Make sure that you wear the proper clothing and hats. Always apply and reapply sunscreen. We can't say that enough. Typically, we recommend sunscreen above 30 SPF or so. And then just stay hydrated. So precaution is always the best prevention in this case. Here at Beacon, we hope that everybody stays safe this summer, and we are here for you during this heat wave.